Hello everyone, happy to be here in my channel. If you are new, I'm Dr. Alfa, medical trainer for MRCP exam. Okay, today's lesson is Alpha 1 antitrypsin deficiency. Alpha 1 antitrypsin deficiency is a common inherited condition caused by a lack of protease inhibitor PI, which normally produced by the liver. The role of Alpha 1 antitrypsin is to protect cells from enzymes such as neutrophil-elastase. It classically causes emphysema, chronic obstructive pulmonary disease in patients who are young and non-smoker, because smoking itself is regarded as the cause of emphysema. Okay. Genetics. Alpha 1 antitrypsin located in chromosome 14, inherited in an autosomal recessive codominant fashion. Alleles classified by their electrophoretic mobility: M for normal, S for slow, Z for very slow. So, normal form is PIMM. Heterozygous mean carrier patient PIMZ. Homozygous PISS 50% normal alpha 1 antitrypsin levels. Homozygous PIZZ mean 10% normal alpha 1 antitrypsin levels. What does this mean? It means normal patient carry PIMM, but heterozygous PIMZ, this is a carrier patient. But homozygous PIZZ, this patient manifests all signs and symptoms of alpha 1 antitrypsin emphysema. So, features of alpha 1 antitrypsin deficiency. Patients who manifest disease usually have PIZZ genotype. Lung feature is panacenar emphysema, most marked in lower lobes. Liver features cirrhosis and hepatocellular carcinoma in adults and cholestasis in children. Let's see the questions. Here is the first exam question. 35 years old non-smoker is referred for genetic testing following the diagnosis of his brother with alpha 1 antitrypsin deficiency. He undergoes protease inhibitor PI genotyping, which confirms PI carrier genotype. He is advised that he is unlikely to develop respiratory complications provided he remains a non-smoker. So, what specific protease inhibitor genotypes does the patient carry? Absolutely, the result is PIMZ, because we said PIMM for normal patient and PIZZ for patient who manifest all signs and symptoms of emphysema, but PIMZ for carrier patient who has no signs or symptoms of emphysema. Okay, so let's see the justification. They said alpha 1 antitrypsin PIMZ carrier and unlikely to develop emphysema if a non-smoker. Alpha 1 antitrypsin is a genetic disorder resulting in a lack of normal protease inhibitor PI production, as alpha 1 antitrypsin protects cells from enzyme destruction. A reduction in its normal form can result in both lung disease in the form of emphysema and liver impairment. These have been severe mutations of the PI genotype identified with alleles classified by their electrophoretic mobility: M for normal, S for slow, Z for very slow, which manifests disease. The heterozygous genotype PIMZ contains one normal allele M and one very slow Z, resulting in patients being cared for alpha 1 antitrypsin deficiency. Having a normal PI allele translates to patients having approximately 60% of the normal serum level of alpha 1 antitrypsin, and therefore respiratory symptoms are very uncommon. especially in non-smoker. Here is our second exam question. 57 years old gentleman present with chronic recurrent cough, expiratory with an increased exertional breathlessness. He has never smoked and very limited exposure to passive smoking. He has no significant occupational exposure to pollutants or irritants. Spirometry demonstrates an obstructive picture with limited bronchodilator reversibility. He is suspected of having alpha-1 antitrypsin deficiency. So, what's alpha-1 antitrypsin? The answer is with green color. Alpha-1 antitrypsin is a protease inhibitor of neutrophil elastase. Let's see their justification. The correct answer is protease inhibitor of neutrophil elastase. Alpha-1 antitrypsin is produced by the liver and by inhibiting neutrophil elastase helps protect the lungs against the function of this enzyme. Deficiency of alpha-1 antitrypsin can cause emphysema and liver cirrhosis. Here is our third exam question. 43 years old lifelong non-smoker is diagnosed as having emphysema, chronic obstructive pulmonary disease. Further tests reveal that he has alpha-1 antitrypsin deficiency. What is the main role of alpha-1 antitrypsin in the body? The answer is protease inhibitor. So let's see their justification. The correct answer is a protease inhibitor. Alpha-1 antitrypsin is a type of protease inhibitor, more specifically a serine protease inhibitor, SERPIN. Its primary function in the body is to protect the lungs from neutrophil elastase, which is enzyme which can degrade elastin and other structural proteins in the lung tissue. In individuals with alpha-1 antitrypsin deficiency, this protective mechanism is impaired, leading to uncontrolled activity of neutrophil elastase and consequent destruction of lung parenchyma, a pathophysiological basis for emphysema, chronic obstructive pulmonary disease. Finally, our fourth exam question. 45 years old man with end-stage emphysema. End-stage emphysema due to alpha-1 antitrypsin deficiency is reviewed by the respiratory team. He is currently breathless, walking 100 meters and struggles with many of his activities of daily living. Which of the following treatment may be useful as a treatment in this case? The answer is lung volume reduction surgery. So let's see their justification. Lung volume reduction surgery can be used in the treatment of alpha-1 antitrypsin deficiency. This question is asking about the late-stage treatment. Late-stage treatment of alpha-1 antitrypsin deficiency is by lung volume reduction surgery. For respiratory management, it is similar to that of late-stage chronic obstructive pulmonary disease. Therefore, of the above options, lung volume reduction surgery is the correct answer. Lung volume reduction surgery is removing the worst affected part of the lungs in order to improve airflow and alveolar gas exchange in the remaining portion of the lung. Finally, don't forget to subscribe to my channel to receive the remaining of my course. And if I'm yours, don't forget to give me your like and share with your friends. Thank you. Bye bye.